panellists for the first session of the series, Planning for Success with Chronic Condition Management. My name is Natalie and I'm from the PHN Education team. And I'm joined today with Sarah Houlihan, who is the Primary Care Practice Liaison Officer and Primary Care Nurse. Before we begin, I'd like to acknowledge the traditional custodians of the land in which we live and work on. For myself, on the Central Coast, that is Jarkenjung country, and I'd like to also pay respects to elders past, present and emerging. A few things to let you know about this session. It'll be recorded and available to you to view in our education library, along with a copy of the presentation slides in a few days' time. As attendees, your camera and microphone are automatically disabled. If you do have questions during the presentation, please send them through via the chat box, which you'll find located in your control panel. These will be answered at the end of the presentation. An evaluation will come to you directly after your session, and your feedback's extremely important. It enables us to provide future educational sessions. Now, it's my great pleasure to introduce Sarah Houlihan. Thank you, Sarah.
Thanks, Natalie. Welcome, everyone, to the first session of our 8-part series. And this is all around the upcoming changes to chronic condition management, which will happen in July. So as Natalie said, my name is Sarah. I'm a practice support officer and a practice nurse. So I know firsthand the challenges and triumphs that can come from quality care planning. I'm also coming to you from Jarkenjung land on the coast, and I want to pay my respect to our First Nations colleagues joining us today, and acknowledge the particular relevance of providing quality chronic condition management for our First Nations people. So as majority of you will know, the change from chronic disease management to chronic condition management was originally planned to start in November last year. However, the department felt that more time was needed to ensure practices and providers were adequately informed and able to implement effective change management strategies, which is why we're here. So our PHN have decided to take the approach of stepping through the change process in small, manageable bites each month. We will, of course, still forward on any information as it comes to hand via email or during conversations when we are visiting with you. But we wanted to have this to break down the process to make it easier on everyone. It is important to acknowledge that the upcoming changes are technically still waiting to pass through legislation. However, we're not expecting any amendments to the proposed changes, and we're not expecting any further delays. So there's a lot of things that we still don't know, and as a PHN, we want to be transparent with you about everything that we receive, so that everyone can be adequately informed. But what we do know so far. So the name change is simple, but it's a really positive move because we're focusing on chronic conditions affecting health and overall quality of life rather than just disease processes. So what will be going is the GP management plan, team care arrangement, enhanced primary care, 721, 723, 732. And what they'll be replaced with is a simple process of chronic condition management with a single item number. So we will still be doing care plans. We will still be providing care for our patients, but we'll be doing it in a much more simplified way. The next change that we know is coming is around a encouragement for continuity of care. So this is where the My Medicare conversation comes in. So My Medicare certainly does play a part in the upcoming changes, but it's important to properly understand how. So you do not need to race out and register every patient with a chronic condition for My Medicare. Nor are your patients obliged to sign up for My Medicare. It is a voluntary program. All eligible patients living with chronic conditions will still be able to receive chronic condition management from their regular GP, regardless of whether they are registered or not. However, what My Medicare does in this instance is encourage identification of the patient's usual practice and encourage continuity of care from their regular GP. Patients who are My Medicare registered will only be able to access care plans from the practice they're registered with. If the patient's not My Medicare registered, they'll still be able to access care plans as appropriate from any provider meeting the MBS criteria, which we expect will remain unchanged. But we don't know for sure until obviously the MBS descriptor comes out. But we expect it will stay the same around the GP who has cared for or will care for the patient in the coming months. And then the third change is around referrals relating to allied health. So the requirement to collaborate with at least 2 other providers in the care team is moving to a much more simple and consistent process of referrals being generated just like any other referral. Now, of course, it would make sense to include a copy of the care plan with referrals, not just to allied health, but to anyone in the patient's care team, so that they have the full picture of the patient's overall care needs. But thankfully, we will no longer be held up waiting for collaboration documents to be returned or phone calls to be returned before we can process that GP billing. And we remove that risk of the patient's care being held up until the billing's been processed. For allied health providers themselves, as far as we are aware, there are no changes planned for other members of the care team. So we believe that the 5 annual subsidised visits or the 10 annual subsidised visits for First Nations people, the item numbers for billing, requirements to communicate back to the GP, we're expecting that all to remain unchanged. Obviously, if that changes in one of the monthly updates, we will absolutely let you know. So if you take one key message away from today, please let it be this. The upcoming changes are not huge. There's no need to panic, but the changes are important. And preparing your practice for a smooth transition will make your life much easier come July. Now, how we will set out the sessions over the coming months will depend on the feedback that we get in the evaluation. I would like to be able to use these sessions to provide, just like this, a brief update and information, and have more time to focus on questions that are coming from you, questions that you're experiencing in practice. I promise you, I may not and possibly won't know all the answers, but I will endeavour to find out for you. We want to, as your PHM, we want to support you through the process. And of course, a good change management process is relevant regardless of what change you're implementing, not just for chronic condition management. So my suggestions for you with your practice over the coming month is around focusing on communicating with your team. So perhaps you might arrange a whole team meeting to communicate the changes. You might, in that meeting, have a discussion. Do we have enough staff? You know, if our nurses are currently fully booked up, do we need to be recruiting now so that we've got fully trained extra staff on board ready for July? Because we're going to be doing a lot more reviews, which is great. Do we need to look at how we're utilising our rooms within our practice? These are obviously, those conversations are very practice specific, but I encourage you to have the conversation with your team. Consider nominating 1 to 2 change leaders within your practice. So these will be the people who will stay very informed of what's coming up, things that you can be doing now to prepare, and supporting people in the practice who might need that little bit of extra help. You might start to develop a script for consistent messaging. So this is when we start talking to our patients around what the upcoming changes are, reassuring them that from a patient perspective, nothing's changing. You'll still come in, you'll have your care plan, you'll still be able to access your allied health as you always have. But on a good note, we're going to be, catching up with you a bit more often so that we make sure that we're providing you with really quality care. And then if you haven't already, please do register your practice for My Medicare, if that's a program that you're wanting to participate in, because that will come July. By having your patients registered to your practice, it will give you that reassurance that they're not going to be having their care plans done elsewhere if they are a registered patient of your practice. Now, I notice there's a lot in the chat around just who was able to see stuff, but no specific questions in there at the moment. If there's anything that's burning, please do drop it in. Happy to answer or find the answer for you today. Otherwise, in the evaluation, as Natalie said, we will actually ask you for what questions you've got ready for the next session. And you are also, of course, welcome to reach out to us at any time. I've put our email there, practicesupport@thepHN.com.au, which is the best way to contact, obviously, our practice support team for the right person to be able to provide you with support. Now, let's have a look. Oh, wrong one. Okay. There's still no information regarding the payment structure. Unfortunately not. What we do know, what the department's been very clear about, is that the payments will be equalised over a year, and that is purposely to encourage reviews of plans rather than just an annual plan that isn't really followed up regularly. But no, we don't know about payment amounts yet, unfortunately. What difference does it make for doctor and patient if they're My Medicare registered or not? Honestly, not a whole lot. Really, the difference for My Medicare registered patients is that they can't have a care plan prepared for them by another practice that they're not registered with. Essentially, that's the crux of it. Perfect. So Natalie's dropped into the chat box the evaluation, and I'm sure there will be questions that will come to mind after today and once you start chatting with your team. So yeah, please do put those in there or into the evaluation, or as I say, you can email us anytime. So we'll keep it nice and short and sweet for today, which we expected it would be. But our next session on 6th of March, we'll be looking at patient awareness, so what we're communicating to our patients, and just reassuring them, making sure that we've got everybody understanding the same thing, and also around a little bit more around My Medicare registration. So Natalie, I'll hand back to you. That's it for me today.
Thanks so much, Sarah, and thanks everyone for your questions. If you do want a question answered for the next session, there is a question in the evaluation that you can fill in, which we will go through to provide answers to those questions for next session. And if you haven't already, please register for the next session via the education page, or I can send everybody a link in the email after this session of how to register for the next one. But thank you everybody for attending. Once this session has closed, the evaluation link through this chat will not be available, but it will be emailed to you after. Thanks all.
Thanks everyone. Thanks, Natalie.